Thank you all for joining us here today. It is my pleasure to welcome Dr. Nana Bennett, Dr. Mike Mendoza, Director Paul Pettit from the Genesee and Orleans Public Health Department, and Wade Norwood, the CEO of Common Ground Health here. There's obviously been a lot of questions in the community around vaccine distribution and accessibility, and we wanted to take an opportunity today to update the community on the vaccination program, where we are with it, and what to expect over the next couple of weeks, and be able to answer some questions that you in the media have as well. In introducing our experts here today, I do want to start by just acknowledging there are a lot of people in our community right now, as of the end of last week, who are eligible for the vaccine, the COVID-19 vaccine. But the eligibility is far outnumbering the number of vaccines that are actually available to be administered in this community. It's important to note this can be very frustrating, but we have to take a step back and not be confused between the difference between eligibility and availability. They're two very different concepts. There are literally tens of thousands of people just here in Monroe County, tens of thousands of more people who are eligible to receive the vaccine right now than there is supply to be able to administer the vaccine to them. And so let's step back and understand how the process works. The federal government is managing, and the federal government and the manufacturers are managing the supply, not the state and not the county. The challenge here is that we don't know week to week how much of that supply from the manufacturers and the federal government is distributed to the state, which is then distributed back down into the local distribution partners, whether that's the county health departments, the hospital systems, directly to the hub, pharmacies, and places like that. So we need to shift our focus here on the local level into what we can control to make sure that our capacity to actually administer the vaccine once it arrives meets the supply of vaccine as it gets here. To that end, we have developed in Monroe County 2 pod sites that we've talked about over the last week and a half. One is at the Fleet Center, the other is at the Health Department on Westfall Road. In addition to that, our teams have been working around the clock to develop additional public-facing pod sites that we're hoping to be operational in the coming days and certainly within the next week, so that if the supply becomes to the point over the next days and weeks where we can do additional shots into people's arms and vaccinate additional people, that infrastructure and capacity to be able to deliver those shots is there and it exists. Do we know how much shots we're going to get next week or how much vaccines or the week after that? No, we don't. But what we can do is be ready for it regardless of what that number is, and plan into the future with the hope and expectation that the manufacturing process and the distribution by the federal government will increase. The state has also announced that it is setting up a large public-facing facility at the Dome Arena. I think that is good news as well. And then those efforts are all on top of what's happening and taking place at the pharmacies, the health systems, and the nursing home facilities as well, particularly the nursing home facilities that have a direct federal contract to administer vaccines there. So what do we know? We do know that people are frustrated. And I completely understand that. We're frustrated because we want the vaccine. We know it's here, and we know that there's a supply of it, and we want it now. And I think that that's good. I get that. I want my vaccine too. And if I could get it today, I would get it today. But we're not there yet. So we have to follow the guidelines. We have to understand who's eligible and who's not. But we also have to understand the difference between eligibility and supply. Right now, the eligibility is much greater than the supply. So we need to control and influence what we can control and influence here on a local level. An awful lot of people, and Dr. Bennett and Dr. Mendoza will talk about this, an awful lot of people in our community have been vaccinated. And I think if you talk around and talk to your friends, talk to your colleagues and your neighbors, you're going to come across a lot of people here who have been vaccinated already. It's certainly not enough. But our goal and what our commitment is as leaders and health leaders in this community is to make sure that our capacity to administer the vaccines when they arrive in this community exceeds the number of vaccines that are here, so that we're ready at all times, regardless of the quantity that find their way into our community. So with that, I'm going to turn it over to Dr. Nana Bennett, who is the chair of the Monroe County Vaccine Task Force.
Thank you very much, and good afternoon to everyone. So where are we in this journey to get vaccine into everyone's arms? Just to review, we began with phase 1A, which included healthcare providers, and in particular those who were patient-facing right now, and long-term care facilities. So we've been working as a community to vaccinate those two groups of people very aggressively. In the last week or so, we've added large numbers of other people to those groups, and they fall into really two areas. One based on age, that is people who are over the age of 65, and one based on profession or job category. That includes people who are public safety workers, fire, police, teachers, grocery store workers, and there are probably a few other categories I'm leaving out. But essentially people who, because of their occupation, are considered to be at high risk and therefore should be vaccinated early. So the hospitals, the federally qualified health centers, pharmacies, all different groups of people have been working on vaccinating these three groups. The thing that's very important to know is, as Adam said, we don't have the supply to reach out to everyone in all of these groups at this time, but we will going forward. And what's important is that we have the systems in place to address this. So far we've received approximately 76,000 doses of vaccine in our region, and that's the Finger Lakes region, comprised of a 9-county area. Those 76,000 doses will all be administered into arms by next week. And then we will be dependent on what our next supply of vaccine brings to us. So that's an amazing accomplishment, and one that I think the region should be proud of. But as we all know, it's not fast enough. And as Adam said, many people are very frustrated. The plan going forward is really divided up according to whether you are eligible because of your age or eligible because of your profession. So for those who are in the healthcare provider professions, we are still vaccinating them and will continue to do so. For people who are in some of those critical professions we just mentioned, fire, police, teachers, etc., the Monroe County Department of Public Health will be working with their employers and their associations, and those people have already been in touch with the health department, and Dr. Mendoza will describe that in more detail. For those who are eligible because of age, the options include your healthcare system. So if you are a patient of a physician that is part of a healthcare system, you will be reached out to by that healthcare system. Each system in our community is composing names of everyone in their system who is over the age of 65. And then they will randomly begin to schedule people into clinics that will be available in the course of the next week or so. But it will not all happen tomorrow. There are a lot of people in the over 65 age group. In addition, federally qualified health centers, community clinics will also be reaching out to their patients and ensuring that they get vaccinated. And pharmacies as well will participate in this effort. Grocery stores that have pharmacies are also included, and they will have availability going forward. But again, it's entirely dependent on how much vaccine we receive in the region. So we are asking everyone to be very specific, to number one, not call your doctor's office. The healthcare systems will be reaching out. They will assign appointments or work with you to find an appointment for you when you randomly become available to them. The Monroe County Department of Public Health will be reaching out to people who are in those critical professions and jobs, and Dr. Mendoza will describe that further. Thank you. Dr. Mendoza.
Thank you, Dr. Bennett. Good afternoon, everyone. Thank you to all of my colleagues here who are working so hard to get this effort going here in our region. And as always, thank you to the members of the media who are also helping us with a very critical role of informing our public during a dynamic and very confusing time. I'd like to take a step back, though, and look at our progress to date, and then discuss how things are changing as more people become eligible for the vaccine. Over the past 2 weeks, Monroe County has been working very closely with our local hospital systems and their respective physician associations, the Monroe County Medical Society, the nursing homes, long-term care facilities, group homes, EMS, first responder agencies, funeral homes, the K-12 school nurses and eventually educators, homeless shelters, Wegmans, and many other community partners and institutions. Our goal was and is still to ensure that whatever vaccine we have available to us in our community will be used quickly, efficiently, and as equitably as possible. And although it may not appear this way, I can assure you that there has been a tremendous amount of communication and collaboration behind the scenes. Our hospital systems and FQHCs have taken the lead vaccinating their own employees and are now opening to eligible patients, as Dr. Bennett mentioned. And from the standpoint of Monroe County, our efforts have focused on people based, again, on their occupational roles. Our larger clinic at the Fleet Center has been focused on first responders, EMS, those healthcare workers who are not affiliated with either of our major healthcare systems, and other defined groups that we could contact relatively quickly. Our smaller clinic here at the health department has been focused on school nurses, funeral home workers, other community-based locations, homeless shelter staff, among others. By the end of Monday next week, we will have exhausted our entire supply, and here in the health department alone, we will have given almost 7,000 vaccines alone. We are using the vaccine as quickly as it comes to us. Looking ahead, here in Monroe County, as we are entering now a new phase, 1B, we are again adapting our plans in collaboration with the hub so that we can make sure that we get to this broader segment of our population. Again, those based on age or health conditions will be primarily served through their healthcare systems, but not entirely. And those based on occupation will be served by the health department, but not entirely. A lot of work is being done at the state level, at the hub level, and here in Monroe County to set up as many vaccination opportunities as possible. But I urge everybody to be patient. It will take time. The process will continue to evolve, and we will continue to evolve with the changing guidance. But I want to make sure that everybody who wants to get vaccinated can get vaccinated, and we will work very hard to make sure that that happens. So with that, I want to offer it now to Paul Pettit, my colleague in Genesee and Orleans County, to provide a regional perspective on how things are going.
Good afternoon. Thank you, Dr. Mendoza. And I'd like to echo the comments that were made before me. This is truly a unprecedented regional effort to try to mass vaccinate so many folks in our communities. I'd like to start by thanking my local public health staff for their continued work and effort over these last 9 months. It's been a long road and we got a ways to go. But, you know, along with my other public health colleagues, I know we want to just continue to thank them for the efforts that they continue to put forth. In addition to all our community partners and the collaborative efforts, both locally and regionally, that continue to happen on a daily basis. We are now only at the front end of this marathon effort, and we have a ways to go, but we'll get there together. Counties around the region are working with our local health systems, our local federally qualified health centers within our counties to provide vaccine for our eligible priority groups. We've been at this for a few weeks now, and that effort continues with the focus continuing to finalize our 1A prioritization groups, now moving into the 1Bs. Vaccinations are slow, but they are occurring in the regional counties. Clinics are going forward. Over the past 10 days, there have been over 40 clinics held outside of Monroe County, again, led by hospitals, FQHCs, and local health departments, again, with the primary focus on our healthcare workers and other 1A prioritization groups. Counties and partners will continue to set up clinics as we receive vaccine. As talked about many times already, this is it's slow. There's a bottleneck in the system, and unfortunately, we're not able to do more without the vaccine. So that is the biggest hurdle for us right now. Eligibility is far outpacing availability. On behalf of my public health colleagues in the region, I would ask our communities for continued patience as this process gets going. We're going to work as quickly as we can to get the vaccine to you. Next, I'd like to pass this over to Wade Norwood, who is here from Common Ground to share some more information on task force efforts in the region. Wade?
Paul, thank you. And I'd also say thank you to Adam, to Mike and Nana. And I would also like to say a thank you to all of your colleagues, you and Paul, Michael, in public health, and Nana, to you and your colleagues in the hospital systems. I can think of no more important work that's taking place in this community right now than the effort that you all are engaged in right now to immunize those who are most at risk in our region and to build the infrastructure to eventually reach everyone who wants to be vaccinated. I know that there remain folks who are hesitant to take the vaccine, and I have a great appreciation for that because I was one of them. But it's been my engagement with the medical community, with the science, and learning about the process that allows me to be, as Adam, eager to get my vaccine. Our job is to make sure that everyone in the community has the opportunity to go through the education and evolution process that I've had the opportunity to go through. That they have the same access to information and trusted messengers and advisors so that they too can make an informed decision for themselves and for their loved ones. And that's why I said yes when the county executive and Nana asked that I join in this effort to launch the Finger Lakes Vaccine Task Force. This advisory group consists of nearly 80 regional leaders across the entirety of the Finger Lakes. And these individuals bring the trusted connections and the knowledge of their community needed to reach out to all populations. I am happy to report that the task force launched last week, and we are again convening tomorrow. And at tomorrow's meeting, we will explore vaccine hesitancy and discuss how to deliver the vaccine so that all residents have access to this critical prevention resource. I appreciate the county executive's introduction because our work has been made more challenging by the changing approaches rolling down from the federal and the state level. And every day brings new changes, and your role, my friends, in providing accurate, timely reports of this activity to our neighbors is essential. And so thank you for being here to cover this briefing. Our goal of the task force is to provide members and other trusted partners with the information and support that they need to accurately and meaningfully educate the communities that they serve about the vaccine, its safety, and its effectiveness. So in many ways, we are acting in the same role that you are, under the very same conditions. And so we appreciate the partnership that you have provided to help us do our major task, which is to mitigate against mistrust and misinformation. I would also report to you that I am very excited that this week, in collaboration with the United Way Systems Integration Project, we begin the important work of hearing from community members directly about what they need to make an informed choice on whether or not to receive the vaccine. We will be talking directly to healthcare workers in Group 1A, specifically focusing on our region's nursing corps. And we will be working our way to other groups in the coming weeks, ensuring that we reach groups with the vaccine that might have trouble getting to medical offices or hospital or community sites. We're also leading a group that is looking specifically at distribution models for older adults, where we might be able to carry the vaccine to them instead of asking them to make their way to the vaccine. And this, we believe, will be particularly important for those who are living in independent living facilities. And all, we are committed to using all the tools at our disposal to share accurate and culturally meaningful messages from messengers that are trusted by each of the subpopulations that make up our regional community. We're looking at the creation of testimonial videos, infographics, and social media that will support the messaging that is needed. But we will never underestimate the power of old-fashioned word of mouth. Our greatest and most trusted tool is the grapevine, and making sure that the grapevine is able to reach across the region through a network of trusted partnering organizations and individuals that will help us do this work in the way it really must be done. Human neighbor to human neighbor, carried on the wings of trust and moving at the speed of trust. And in an era characterized, unfortunately, by divisiveness and misinformation, we are painfully aware of how important it is that we restore trust and remain in relationship with each other. And that is going to be the tool that we continue to keep centered in this work, because equity of uptake of this vaccine is our ultimate goal. Adam, I'll hand the meeting over to you for questions.
Thank you, Wade. And Steve here will manage the questions going forward.
Great, thank you. We have a lot of reporters on the call today. So to start, we are going to limit to one question each. If we have time afterwards, we will circle back through the list. First up is Patty Singer from the Minority Reporter.
Oh, Steve, why did I think that was going to happen today? Thank you. You got me. I was scribbling down all kinds of questions. All right, one question. Wow. Okay. How will you use this time? Because you have more people who want this than vaccine. How are you going to use this time productively then to get that message out? And maybe this is more for Wade. You've got time, in a sense. You have a lot of anxious people anxious and eager who want a vaccine, but you have some time because it could take weeks before you get to everybody. Can you be specific about how you're going to make the best use of this time to help overcome some of that reluctance? So when the vaccine is ready for those people, they're there, and this is going very smooth, very quickly for you.
Patty, I think that the first thing is recognizing that some of this, what might seem like potential bandwidth, has to be spent to deal with the issue of confusing messages and the fact that there's pent-up demand. So there is a part of the community engagement effort that really needs to be devoted to helping to accurately communicate what's going on and to allow people who really are already motivated to remain motivated and not be deflated or made bitter or cynical by the fact that demand is outpacing supply. But to answer your question, we have always believed that the best approach would be what I'm calling a snowball approach, that we are able to use the folks who are already vaccinated or already motivated to be messengers for us to reach to their community. And that's what this, I would say it's always been a belief that we should be looking at the folks who are downstream in the way the groups are situated and understand now's the time to talk to them before the vaccine is available. So this is really just the environment conforming to what is always the best strategy. And so that's why we are talking now with the folks who are in Group 1A, so that we can, A, motivate those folks who have not yet been vaccinated, find out what the barriers are and address those barriers, but also leverage their voices because physicians and nurses are such trusted figures in the community, that we can engage them as partners in speaking to the other groups that are subsequently going to be lined up and eligible to be vaccinated, so that when their time arrives, they will be ready. So it is the direct engagement with real people and the enlistment of health professionals to help us do so that will be the work that consumes us in the next 3 weeks.
Thank you.
Great. Next is Noelle Evans from WXXI.
Hi, thanks so much. My question is for Mr. Norwood as well. Regarding specific educational campaigns, I'm wondering what some of the biggest challenges may be, especially in reaching folks who may, in Black and Hispanic communities especially, who have reason to be skeptical, but may be getting swept up in some conspiracy theories. I'm seeing some protests being organized around this. So I'm wondering, while you're working on the snowball effect, I'm wondering, how are you reaching the folks who are on that edge, who might be vulnerable to getting swept up in misinformation?
I think that misinformation and mistrust exist all along the chain of the different community groups to whom we have to reach, Noelle. And I am very concerned about misinformation and conspiracy theories, but we have to recognize the very long history of injustice and misuse that really sets the context for why community members feel the way that they do. And I am incredibly proud of how this community, as part of its work towards social and racial justice, has been having open and honest conversations about that very fact. I was able to participate in a community conversation about medical apartheid that was just recently hosted. I think that being honest, being straightforward is the key. Autonomy and individual self-determination is at the heart of all that we will do in this space. But I will be very clear with every human soul I reach that as for me and my house, we are going to take advantage of the blessing of science to make sure that we are protected through the vaccine that's made available. I sadly will be memorializing a lost soul in the coming days. This is a very serious disease that is spreading across the globe, and we in Rochester should do that which we can to protect the health of our community.
Thank you, Noelle. Next is Howard Owens from the Batavian. Do you have any questions?
Hey, thank you very much. So my question right now is regarding to the supply issue and what you can tell us about where that bottleneck is. Is it a lack of supply, or is there something at a government level or private sector level that's causing the bottleneck? Is it federal government, state government? Where is the problem?
Well, I don't know, Nana, do you want to, or do you want me to, what I could say is this, it's all about the supply that's coming, that's being directed through the federal government and the manufacturers. So, the governor had acknowledged last week that the New York State is receiving roughly 300,000 doses a week. New York State then takes those doses and distributes those to all of the distribution partners, people who have signed up, or institutions that have signed up online, or however they sign up with the New York State Department of Health, to administer those vaccines in their community. So that's the supply chain. So New York State, I don't believe, is receiving vaccines directly from the manufacturer. They receive them through the federal government's distribution by order of the federal government. So the issue is that in order to reach everybody in our community that is looking for a vaccine and is eager to receive it, there has to be a greater emphasis on the manufacturing of the vaccine to get additional vaccine out into the community. At the local government level, what we're focused on in Monroe County, what I know our peers are focused on all the counties here, is the distribution aspect of that, because the hope and expectation is that over the next several weeks and months, that 300,000 becomes 350, 400, 500, 600,000. And we don't know when that will be. We're notified essentially weekly how much we have. That's why Dr. Mendoza is able to say we'll exhaust our supply that we have right now early next week. We don't know how much then additional we're going to get next week. But we need to be prepared for that in the eventuality that it's more. And so we need to continue to increase our capacity to deliver the vaccine, not knowing how much is actually coming in. Dr. Bennett, did I get that right?
Yeah.
Okay.
Definitely. We have very little control at a local level over how much vaccine we receive. And I don't think New York State has control either. So we're really a little bit at the mercy of this supply chain and waiting to hear how it will grow. And we do anticipate it will grow. I mean, that is one thing I think we can say with insurance is that the 300,000 doses a week to New York State will no doubt get larger over time.
Howard. Next is Berkeley Green from WHEC.
Thank you, Steve. Dr. Mendoza, question about teachers and educators. Yesterday, you briefed school superintendents on the plan to vaccinate teachers, and you told them about 2 megapods at the convention center downtown, at the Dome Arena in Henrietta, and the ability to do thousands of people every week. What is your message to teachers watching right now about when they are going to get vaccinated?
So first of all, I want to say thank you to our teachers. Let's not forget how much work they've put in, how much extra effort they've put in throughout the entire year. Teachers, parents working together with their school administrators. It's because of all of that work that they are understandably eager to take this next step. I'm grateful for that. I'm also grateful for their patience. I totally understand that many people want to get in line and want to be at the front of the line, and I would too if I was a teacher. But the reality is, as we've discussed, that the supply of vaccine is just not quite there yet. And so thank you for your patience. We will reach out to you. I have meetings weekly with the public school superintendents. I have another meeting set up with the private and charter school superintendents and leadership. We are doing everything we can to make sure that everybody is ready so that if and when the time comes, and the time will come, where we have much greater vaccine capacity, we'll be prepared to vaccinate as many people as quickly as we can.
Great, thanks, Berkeley. Next is Kenner Dubenville from 13 Web.
Hi, good afternoon. I know that a lot of the message has been that there really just isn't the supply yet to get it out to everybody, but it does still seem like there is a lot of confusion over who and when and where and how. I guess, are there any plans, or should there be anything in place, a uniform guideline, laying out just what exactly the protocols are to eliminate some of the frustration?
Should I take that?
Yeah, go ahead, Nina. Yeah.
Yes. I mean, the short answer is yes, of course. Currently, there are some resources. I know a lot of people have gone to the New York State website related to COVID vaccine. That web is very useful in determining whether or not you are in a eligible group at this time. So that's one resource that people have available, and we can put the link in the chat. In addition, there's now a hotline at the state that people can access to ask their questions. We'll also put that in the chat. Other options include the Monroe County website, which has a great deal of information on it as well. We are hopeful that all of you will help us get the word out about which populations are eligible to receive vaccine right now and what those populations should do. But again, because we do not have large supplies of vaccine, many of the options for people are not available currently. Again, eligibility does not equate to availability. And so we are really asking people to be patient. I think we've talked about some of the ways that vaccine will get to different groups of people in a population, but don't be disturbed if you haven't heard from your healthcare system today. You will probably hear from them by the beginning of next week, but that if there's no vaccine, there's nothing to tell anyone. So it's really very dependent on our receiving supplies of vaccine and then the relevant groups being able to reach out to the appropriate patients.
Great, thanks, Tanner. Next is Mike Hibbard from the Finger Lakes Times. Mike, do you have a question? Okay, we'll come back to him. Next is Wendy Wright from Spectrum News.
Hi there, nice to see everybody today. Just following up real quick on what you were saying, Dr. Bennett, in regards to getting the message out to those folks who are in the right populations. One of the groups added were folks who are immunocompromised. Can you explain, you or Dr. Mendoza, who that would be and how people know what ailments they might have to be considered immunocompromised?
So as of today, we do not have good guidance from New York State on which groups are involved in that population. And we are awaiting that guidance. The guidance we received overnight from New York State was to focus on those who are over the age of 65. So I think additional guidance will be coming and we will share that with you as soon as we have it.
Thank you.
Thanks, Wendy. Next is Atia Collins from WROC.
Hi, good afternoon. My question is surrounding, you said you're expanding the infrastructure and the sites and making sure we're ready to distribute the vaccine once it gets here. I've talked to some private pharmacies who say they're just not hearing word of when maybe they'll get involved. So my question is, are you reaching out to some private pharmacies, some other centers, and how is that process looking?
So I can take that also. So many providers, potential providers of vaccines signed up with New York State to be providers. Not all of them received vaccine this week. And we don't know on what grounds those decisions were made, but just as an example, Wegmans received vaccine for a certain number of their stores, but not other stores. So we don't know exactly how that happened or what the decision-making process was. But we anticipate that people who did sign up to be providers will eventually receive vaccine when there's a greater supply.
Okay, next we have Brian Sharp from the Rochester Democrat Chronicle.
Thank you. I was wondering if you could speak to those folks who at this point have gotten their first dose, but not their second, and might be listening to this, getting a little concerned, both in thinking of, people who, how much play there is if they're battling with this big influx of folks for appointments. Can they be a few days or a few weeks beyond? And also with the county, I understand that their sites are not, unlike the hospitals, scheduling that second dose. How to make sure you're getting those people back in for that second dose.
So first of all, let me clarify that for the Pfizer vaccine, the second dose is to be given 21 days or more after the first, and for the Moderna, it's 28 days or more. I think there's a lot of confusion that you must get the second vaccine on exactly 21 or exactly 28 days, and that's not the case. That's the first day that you should be getting the second dose, but there isn't a window that closes on day 22 or day 29, if you will. But in general, we have been telling all who have gotten their first dose to check back with the location where they got the first dose about getting their second dose at that location. The ways that people are scheduling vary somewhat, but in general, we will be reaching out to all of those people because we know who they are, and we will try to bring them into the same location for their second dose, assuming that we don't have a larger option or a different option that we will refer people to. But in general, we'll be bringing people back to the same site as their first dose.
Great. Next is Lucas Day from Finger Lakes video. Okay. Will Astor from the Rochester Beacon.
So I'd like some clarification for those people who are eligible and want to get the vaccine. For those of us who are being treated by one of the health systems, is the preference to wait for that? I mean, if you go to the state site and you determine you're eligible, it says, here's the people who are giving it out, go to them. And, you know, they may or may not have it. So do you want people who are being treated by a system doc to wait? And does that apply to any doc, or is it just your PC?
So the systems are constructing lists of all of their patients over the age of 65 and will be randomly assigning them to appointments to receive vaccine. Obviously, anyone has the option to go to a pharmacy or to go to some other location to receive vaccine. But I think the systems have a very robust program planned to get their patients vaccinated. But don't call them. They really will have to call you, because otherwise it's just chaos. And so everyone must have an appointment. No one should ever go to a clinic without an appointment, because they just won't be able to serve you. And many places the appointments are filled at the moment because we have such a limit on our supply of vaccine. So, you know, you certainly have many options. I personally am going to wait till my healthcare system calls me up and tells me to come, because I think that is the most efficient manner to get vaccinated. You know, these systems will also, if you live with someone, they will ensure that, and who uses their healthcare also, they'll ensure that you're scheduled together to make it simple. They will ensure that the information that you received your vaccine ends up back in your own medical record, which if you go to some other location may or may not happen. So it's a very efficient system. I think it makes a lot of sense. But I understand that people want to get vaccinated quickly, and so they're looking for all different options.
Okay. Next is Brian Quinn. Brian, do you have a question?
I don't know if he can't get audio, but his question is for Paul Pettit, asking that the SUNY Chancellor had made a statement about Genesee Community College being used as a mass vaccination site. And will those plans go forward? If so, when? And will that be at the Batavia campus?
Yeah, so there was an announcement put out earlier this week by SUNY. We have been working very closely with them. This has been one of our identified pod sites for many years in Genesee County, and also a collaborative site for Orleans County. So we are in the process of standing our county-sponsored pod, very similar to what's been talked about in Monroe County, over at GCC. And the plan is to stand that up potentially starting next week. Again, as we've talked about many times, vaccine dependent, right? But we will be vaccinating over there Monday, Wednesday, Friday, and we'll be in Orleans County, site to be determined yet, but on Tuesdays and Thursdays. So for the folks in Genesee and Orleans, we will be vaccinating 5 days a week. And again, more information will be coming out when the vaccine becomes more available and we start scheduling clinics. That information will be shared widely and publicly when the time comes.
Okay. Last question is for Daniel Kushner from City News.
Yes, hello, thank you. This is directed to Dr. Mendoza and Dr. Bennett. I'm interested in hearing more about the 2 pod sites that you mentioned in terms of the capacity that you expect to be able to handle with regard to the weekly distribution of vaccines. All things being equal, should the vaccine be readily available from federal and from the federal government and individual manufacturers, how quickly do you think those pod sites would be able to effectively distribute enough vaccine to accommodate those in phase 1?
So I'll start first by stating that those plans are still being developed. We have the infrastructure plans, we've got the workflows and all of that set up. The staffing is a major concern. Second to the vaccine itself, I think staffing is probably the second most important concern. We are hiring additional employees and nurses, as you have probably learned earlier this week, into the health department to help staff the clinical positions in these pod sites. But we're looking at thousands a day eventually when we get to that point. But obviously, we're not going to start that quickly. There's a lot of things that we want to make sure we get right. This vaccine is not like other vaccines that we're comfortable with in normal settings. This is not the flu vaccine from the standpoint of ease and storage and transportation and all that. So we've got to get through all of those logistics and learn as we go, as we have been all throughout this pandemic. But those plans are being finalized, and we will share more as soon as we have the plans final.
Great. All right, thank you, everybody. Thanks for joining us today and helping us to get this information out to the public. And I want to thank, again, everyone who joined us here today, Dr. Bennett, Dr. Mendoza, Director Pettit, and Wade Norwood from Common Ground. Thank you all for your work, and we'll see you at our next briefing.